The industry we've asked to absorb a global pandemic, a mental health crisis, staff shortages, and constant regulatory change had the lowest scores in my doctoral study on every single construct that predicts team adaptability. Not the lowest on one measure, the lowest on all five. Healthcare teams in my study of 291 professionals across several industries scored the lowest or near lowest on team coaching, team learning agility, team resilience, team goal commitment, and team adaptive performance. The differences were statistically significant. So not noise, y'all. I'm talking about meaningful differences. And the pattern is the same story repeated 5 times. It's interesting because the industry we rely on for human well-being has the weakest team infrastructure in the sample. Today, I'm going to walk you through exactly what the data shows for healthcare, why it looks the way that it does, what the industry gets wrong about burnout, and what the research says would actually change the trajectory. Let me walk you through the specific numbers because the pattern matters. Team coaching. Healthcare scored 3.37 on a 5-point scale. That's the lowest of any industry in the study, significantly lower than consulting, education, finance, manufacturing, and the military. The gap to consulting was 0.84 points, which is massive in organizational research. The coaching infrastructure that should activate every other adaptive capacity is the weakest in healthcare. Next, team learning agility. The score was 3.51. Again, significantly lower than consulting, finance, and manufacturing. In an industry where protocols change, new treatments emerge, and patient populations shift constantly, the teams responsible for adapting to those changes scored amongst the lowest in the measured learning agility. Next, team resilience. There was a score of 3.41, significantly lower than consulting, finance, manufacturing, the military, and even technology. That is probably the most counterintuitive finding for anyone who thinks healthcare workers are inherently resilient. The individuals may be, the teams structurally are not. Next, team goal commitment. There was a score of 3.63, significantly lower than consulting, manufacturing, and the military. When the mission is clear, save lives, care for patients, you'd expect shared commitment to be really high. The data really shows something different. The commitment healthcare teams show isn't matched by the team level goal alignment the instrument measures. Then there is team adaptive performance, which scored 4.07. This was significantly lower than consulting, education, manufacturing, and the military. This is the outcome variable, the actual measurement of whether teams performed under complex and changing conditions. Healthcare teams scored the lowest. Look, let me summarize it for you because the pattern is interesting. We're talking about 5 constructs and healthcare at or near the bottom on every single one. This isn't one weakness, y'all. It's systemic. Just a systemic profile is what it is. The consistency of the pattern is what makes it diagnostic. A single low score could be noise, it could be due to context, it could be a multitude of reasons. But when you say there is 5 low scores together, man, that tells you something structural is happening. And that structural something is what the rest of this video is all about. When healthcare organizations talk about symptoms, exhausted teams, high turnover, performance that erodes under pressure, they almost always use one word. And that one word is burnout. I want to challenge that framing because burnout is a symptom. It is really not a diagnosis. And treating symptoms without addressing the underlying system is why every burnout initiative I've seen in healthcare has produced marginal results at best. Let me map my data onto conservation of resources theory, which I use as a theoretical foundation in the dissertation. Conservation of resources theory says that teams function on a resource economy as such. They have resources like energy, coaching, trust, information, and their performance depends on whether those resources are being depleted faster than they're being replenished. Healthcare teams, boy, they are in a constant state of resource depletion. Patient demands are high. The emotional load is also very high. Administrative complexity is growing. Staffing is thin. Every day drains the resource pool. And it just really became abundantly clear when the pandemic happened. Now, take a look at the coaching score of 3.37. Coaching is the primary resource input in the model, the mechanism by which teams replenish their capacity. Healthcare's coaching score is the lowest of any industry. So the teams with the highest resource depletion are receiving the lowest resource replenishment. That right there is a diagnosis. Healthcare isn't suffering from a burnout problem. It's suffering from a resource imbalance problem. Demand is high, replenishment is low. For long enough that the team level capacities have truly eroded pretty much across the healthcare industry. And here's the statement. The burnout framing makes it feel personal. Individuals need more rest, more wellness programs, more resilience training, and I get it. The resource framing makes it structural. The system depletes faster than it replenishes. The fix is at the system level, not the individual level. These are two very different interventions with very different cost and very different outcomes that must be looked into. There's a specific confusion in healthcare leadership that I want to address directly. The idea that healthcare workers are resilient. I think they are, okay? Let me just say that. I don't want anybody coming in and getting me. I think they are. Individually, I think they are. Healthcare workers face life and death decisions daily, okay? They absorb emotional weight most people will never experience. I've had classes with people that, were in healthcare or in healthcare, and it's just different. They show up for 12-hour shifts on a regular. They handle crisis. They care for patients. As individuals, healthcare workers demonstrate extraordinary personal resilience. But individual resilience and team resilience are fundamentally different constructs. And my data shows healthcare has the individual, but not the team. So I'm not saying the individual doesn't exist. But what I'm measuring is purely team, okay? Team resilience is emergent. It lives in how the team recovers together, shares the load, protects each other's capacity, and sustains performance as the unit. Individual resilience can mask a lack of team resilience by having people shoulder more and more and more individually. Yeah, the hero syndrome that we've talked about before. Eventually, that produces burnout and lots of turnover because individual resilience has its limits that team resilience would have bridged. Healthcare leadership often uses the individual heroism as a proxy for team health. The nurse who covers the extra shift or two, the doctor who stays late, the team that just makes it work every single time. See, my data says that pattern isn't resilience at all. It's resource depletion disguised as performance, and eventually it's going to collapse, y'all. The structural fix is this: build team level resilience through team level coaching, not individual coaching strategies. Team resilience is built through shared mental models, distributed leadership, and adaptive learning routines. The behaviors that Gallagher and colleagues identified in 2015. These things are coachable. The research is extremely clear on it, but they have to be coached at the team level, y'all, not the individual level to make this work. So, what would actually shift these numbers based on the model? I'm looking at 3 interventions, y'all. First, treat team coaching as the upstream investment. Coaching predicted resilience at a beta coefficient of 0.647, commitment with a beta coefficient of 0.681, and learning agility with a beta coefficient of 0.720, or all of them are really large effects. If you raise the coaching score, the model predicts the other constructs rise with it. One intervention, cascading impact is their point. Second, stop funding wellness programs as the primary team intervention. It's not. Wellness programs also target individual coping. They don't build team level capacity, y'all. They just don't. I mean, I have them, but treat them different. The data says the missing capacity is structural at the team level. Once again, individual wellness is helpful. I agree. But it's not the leverage point the model identifies. Third, measure the team level constructs before and after the intervention. Most healthcare systems measure turnover, y'all. They measure engagement. They measure patient satisfaction. Those are outcomes. Those are lagging indicators. They tell you the system is broken, but not what's broken. You see the difference? The 5 Thrive Q constructs, coaching, resilience, goal commitment, learning agility, and adaptive performance, they tell you exactly where the system is degrading and where the intervention would produce the best measurable change. That's what Thrive Q was built to actually do. Diagnose the team level conditions. Prescribe the specific coaching intervention. Measure the delta, y'all. Okay? That's the measurement framework that healthcare systems don't currently have. And we got to get to the point where they do have something like that, because otherwise we're going to still be hitting with that one word that I told you about earlier, which is burnout. Now, you need to acknowledge the constraint, right? I know healthcare budgets are thin. No question on that. I know every department is competing for resources. This isn't an argument for more money, by no stretch of the imagination. It's an argument for reallocating the money that you're already spending. What's being spent on the individual wellness, turnover replacement, and quality committees is already significant. The data says some of that budget will produce more measurable impact if redirected to team level coaching infrastructure. That's really the point, y'all. I'm not trying to tell you to go ask for billions or more dollars. Redirect some of that effort, and trust me, you'll see a result. Healthcare is the industry I studied with the largest sample in my research. 70 participants, 24% of the total sample. The findings from that subgroup are some of the clearest in the entire study. I'm not painting healthcare leaders as failing. I'm not doing that. Not at all. I'm saying the playbook most healthcare systems are running doesn't match what the data says would work. The intent is right, and I know that it is. The execution target levels are wrong. Individual instead of team. Symptom instead of system. Here's the deal, y'all. We've talked about healthcare today. Next week, we're going to go in a completely different direction. We're going to talk about the technology industry and go on a deep dive. Tech teams ship fast, they do. But the data says they don't adapt fast. Why that's a distinction? Why does that really matter as a distinction? If you lead a healthcare organization or advise one, then look, you want to check out ThriveQ at atypical.com. So look, subscribe. I'll see you next week. From complexity to capability, y'all.